Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Drea. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hi, we are Brit and Drea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Dr. Chris Peterson, a well-known local dentist and the founder of the Wisconsin Tongue Tie Institute in De Pere, Wisconsin. Dr. Chris specializes in releasing tongue and lip ties for patients of all ages with a special focus on infants. His journey into this specialized field comes from personal experience, as his own daughter Audrey had a tongue tie, and as a dad, he had to navigate the challenges firsthand. Since having his own practice, which started in 2017, Dr. Chris and his team have and continue to make a significant impact by offering not only oral tie revisions, but also in-house support for lactation, myofunctional therapy, speech therapy, and more. Beyond his work, Dr. Chris enjoys spending time with his wife and 3 kids, hunting, fishing, and cheering on the Packers. We're excited to have him here to share his expertise and to answer a lot of your questions related to tongue ties, orthodontics, mouth breathing, lactation challenges, sleep apnea, and more. So without further ado, let's dive into today's conversation.
Hey guys, welcome back to the podcast. We are really excited to have Dr. Chris here with us in episode 2. We are going to be talking about lactation support and the importance of it for families. And so, Dr. Chris, what role do lactation consultants play at Wisconsin Tongue Tie Institute?
Yeah. First, let me start with, I didn't get into dentistry to talk about breastfeeding and bottle feeding, and I never ever thought that I'm not an expert in those things, but I deal with it every day, so we have a lot of conversations about it. So I'm a lot more comfortable now than I probably was 8 years ago talking about this stuff. But when we started seeing infants in the office, back in 2017, it did not take me long to realize, oh my gosh, I need someone on my side that knows way more than I do about this stuff. So we ended up bringing in 1 lactation consultant, and that turned into 2, and now we got 3 part-timers that are awesome. They are amazing, and I absolutely love everything about them. They're all my favorite. I tell them that all the time. So if you're listening to this, you're each my favorite.
Oh, well, when we've met, I think we've met all 3 of them too. It's just through some of our alliance events and stuff, and I know that they're very passionate about what they're doing too. So that's really amazing. So when patients come to see you, are they the ones that diagnose the tongue and lip tie, or how does that work?
Yeah, great question. Technically, they're all nurses, so that's outside of their scope of practice, and they always say to parents, hey, I can't diagnose this, with air quotes. I can't diagnose this, but they can pretty much,
I know what you're talking about.
Identify. You got it. There's a better word for it.
Yeah.
We're being PC here.
Right, yeah.
But yeah, the appointment works like this. When an infant comes in with a tongue or lip tie concern, we like to have the lactation consultants do the first 30 minutes of the 90-minute appointment. So they do their feeding assessment. So we tell parents to bring the baby hungry, ideally. If they can't hold them off, it is what it is. But if we can get a nice feeding assessment to see breast or bottle, how things are going, if the lactation consultant, I'm not there for that part, but the lactation consultant will dive in and kind of troubleshoot in that 30 minutes, and then I'll come in and we'll do the education piece, and I'll get their story from the parents, because a lot of times they just want to talk. So we love to hear their story and see what they're struggling with, and then see what the lactation consultants have to say about how the feeding went. So we go over the Hazel-Baker assessment that the lactation consultants do, which is assessing for appearance and function of a potential tongue tie, or the frenum underneath the tongue, it's called. And then how deep the latch was and stuff like that. And so they'll give me the information that I need to know to help the parents make a really good decision. We love to educate, whether on the dental side of the company or the tongue tie side, and let the parents make their own decision and support them through that. We want to do what is best for them always. So the lactation consultants are a big piece of that puzzle because they can evaluate the function. And that's what we want to do. If we're going to treat an infant, we want to make sure that we're evaluating how things are working. It's not all about how it looks. It's a piece of the puzzle, but it's about how it's working. Yeah. And if it's working, I don't really care how it looks, honestly. It's not a problem.
Right, exactly. I love that you guys are so much into the education piece, because that is so important for families when they come to you and trying to figure out what's going on with their baby. Mm-hmm. So what are the most common reasons why moms are coming in for lactation support? Is it because they've been told they need a release done, or they have tongue tie, or is it because they're just looking for lactation support and they didn't even realize that tongue tie could be part of their problem?
Yeah, absolutely. One of the things that we went through with naming the company Wisconsin Tongue Tie Institute was, gosh, do we just call it a wellness program, center or something like that? Because we don't want to just treat kids that have tongue ties. Right. So maybe we do need to rename it. I don't know. But we do standalone lactation support for a lot of families, and that's been a growing thing. So that's been really good. I got amazing LCs that will go prenatal visit all the way through the whole journey with the parents. And but most of the patients that come in, it's all about tongue tie, lip tie stuff and concerns that they're having. Things aren't going well, basically. And then we support them through that journey. That's the other really cool thing is, hey, if you come in for a tongue or lip tie, we will let you know if we think we can help you through that journey, and not only fix the structural issue if there is one with a tongue or lip tie, but also support you the next week and the week after that, and a bunch of lactation visits if we feel like that's necessary. And I think every single parent, I don't care if it's your fifth kid, right, you should have a lactation support of some sort with a good LC in your corner, because it's tough.
Mm-hmm. Well, and every kid is different. There you go.
And that's from experience from both of us.
Yeah, for sure.
Yeah. So what are lactation consultants actually looking at during a feeding assessment? So if a parent is at home and they are currently breastfeeding, what are signs of a good feeding versus indications of a problem?
This is where I wish I had one of my LCs sitting right here so she could answer those questions. But, I know enough to be dangerous, I always say, about this stuff. So they're looking at the depth of the latch. They're looking at positioning. And if it's a first timer, a lot of times they're fixing things like that and making sure that the parents know, milk supply, pumping, pump fitting, stuff like that. But when they're evaluating the function of the feeding, they're evaluating, like I said, the depth of the latch, but they're also looking at, so that Hazel-Baker assessment that I'm talking about, they'll have baby suck on their finger, which we're a big advocate of, because you can't tell from looking at the outside of a latch what the heck the tongue is doing on the inside. You can't tell. You can tell the depth of the latch. That's about it. You can tell, you can hear swallows, and you can see if baby's got that good rhythm, and if they're breaking suction, stuff like that. But we want to make sure that they suck on our finger, and then we're going to evaluate if the tongue can elevate, if it can cup around our finger, if we're going to be breaking suction, if the upper lip is flanging, stuff like that.
And you have 3 kids. And in our first episode, you shared a little bit about your oldest and how she had a tongue or lip tie, and that led to some breastfeeding challenges. Do you have any, did your other kids have any challenges? What have you as a family experienced that you wish you had a lactation consultant in your corner, which maybe you did by the time your younger two were born, but what were some challenges you experienced personally? Yeah.
So first off, we had 3 kids, 3 different lactation consultants, and 3 kids that fed completely differently. Like you said, different positions for each kid that they liked, and, different game plans and different bottles and, all those things. But, our second child, Louis, my buddy, he's my sports buddy at home, and he's got a ball in his hand all the time. But, I love him, but his first few months of life were tough. It was tough on us as a family. From 1 to 2 was definitely our struggle. For the first 4 months, it was we had a couple bouts of mastitis, and my wife, that's tough. So that is hard. That's another thing that we've gone through, and I sympathize with those moms that are going through that, because that just wipes you out, and then you got to watch other kids too sometimes, and they need that support system behind you. So I tried to be that for my wife, and it took a toll on our family, and so I fixed his tongue and lip tie at day 3. Because we waited around. It wasn't that bad of a case, but we thought, okay, it's starting to pinch a little bit. My wife's like, yeah, just go get it fixed. So we took him in day 3 and lasered his tongue and lip. And it took us a little bit to get used to positioning with him was different because you think the second kid is going to be the same as the first, like we were talking about, and it's not at all. And so sleeping was a concern, and weight gain and stuff like that. But once we got the routine and we had the support behind us of that lactation consultant for 4 months, it wasn't like an overnight thing. It was like weekly follow-ups with our LC for months. So thank the Lord for her. Yeah, we're so thankful for that support because we think you're going crazy by yourself. So that's why I say every kid that's born, and parents are trying to breast or bottle feed, honestly, you should have someone in your corner just kind of giving you advice, whether that's a really good friend or a family member or a lactation consultant, preferably. But yeah, they're lifesavers.
Yeah, you need that encouragement and just you're doing the right thing. Keep going. Or let's just change this up a little bit because you don't know.
Yeah, you don't know. We always tell parents, hey, if things are going well in your mind, what's wrong with having another appointment with the lactation consultant and do a weighted feed and really have peace of mind? Like, okay, yeah, we're on a roll here.
You're not going to regret it. Mm-mm. That's for sure.
Yeah, and you learn something every time.
Right.
Yeah. And I think you mentioned pump fittings before. So I think about, every woman is different. Speaking of like breast size and stuff. So do you guys help with pump fittings and then also bottle feeding because babies prefer different bottle types? So how do your lactation consultants support families in those ways?
Yeah, absolutely. Like I said, they can speak better than I can about it, but we definitely have pump fitting sessions with the lactation consultants. They got the nipple size chart that they always look at, and I see that thing all the time. We kind of joke about it that I'm like, what the heck? I didn't know what it was when I first saw it. And they had to teach me, that's a nipple size thing. And I think I got all red. But so yeah, they go through all that and they support parents through that. Bottle feeding stuff too. We definitely have, I believe all of our LCs are trained on bottle feeding breakthroughs, I think is what the course that they took. So help and support that journey too. We see a ton of bottle feeding babies, ton of them, probably half of them that we see are bottle feeding, and we love to help. It's not only about bottle shape, but it's about the flow and how warm to make the milk, and I mean all those certain things that especially first timers they don't know. Mm-hmm. So yeah,
this is just such a really hard journey, and as much as you said, it is important to establish care during pregnancy. You can, and that's important. And you can learn as much as you can, and you are able to, but then you can't actually apply it until a baby is born. And so it is a journey, and it's a challenge for a lot of women. Do you have any examples of when lactation support made a significant difference in someone's breastfeeding journey? I feel like a lot of women out there could be listening and feeling really discouraged within their own journey. And so just kind of hearing a success story or something where you could see a difference was made is always encouraging. Yeah,
absolutely. Two of them come to mind right away, and I would love to share both of them. We have a dental patient of mine on the Pere Smile side that they had their first child, and they brought their child in at age 1, which is when we recommend their first dental appointment. And immediately, I saw a tongue and lip tie, and I first question, how was breast or bottle feeding? Oh my gosh, I couldn't do it. It was too painful. Oh, okay. Tell me how did bottle feeding go? It was terrible. We didn't sleep. Kids spit up all the time, gassy, fussy. I mean, these are the conversations we have every day. And I said, okay, well, and by the way, she was pregnant at that point. And so obviously I had to have a conversation like, hey, breastfeeding, I'm just going to educate you on the benefits, not only, for you and for baby, and making it easier than pumping or doing formula and cheaper and stuff like that. But oral development, it's the best thing you can do for your baby. But we're going to help you through that the second time around if you want to. And she did. She signed up for a prenatal visit, learned a ton, and then we fixed the tongue and lip tie at first week of age, and then we supported her through it. She breastfed for a year.
Amazing.
Yeah. So your past story doesn't need to be your future story.
100%. Mm-hmm. We've had a couple moms like that where from the dental patient side of things that we were able to get ahead of. So that was really rewarding. And the second one, they're not going to mind me sharing their names even. So Dr. Jack Orzapowski is our third dentist on the Pere Smile side. He just had his first kid, so I call him Big Daddy now. But they're great parents. His wife is a dentist as well, Dr. Taylor. She's starting soon at Shesky Family Dental in Little Chute. But yeah, they have their first little one at home, little Nellie, and I said to him right when I found out, I'm like, hey, my gift to you is free lactation support, my friend, and a tongue and lip tie release if there is one. Because right when he said they were expecting, I said, let me look at your tongue real quick, because a lot of times this is hereditary. And, he said, yeah, I had a tongue tie fix when I was younger. And his wife said the same thing. And so little Nellie, they brought in first week of life, and we're like, oh my gosh, there it is. It's terrible. So we fixed it, and I think they're a month in right now. They have a 1 month old, and we've done a bunch of lactation visits, and they are crushing it. And I get to have really good conversations with this guy, and he's not, at his wit's end at where I've been, first month of having a new baby, where things are not going well and they're fussy and colicky and swallowing a ton of air and it's just not going well. And the mom's got mastitis. Like I'm not going to say that they would have had all those things, but it was going down that road, and we see that all the time. I mean, that's what we deal with every day. So
he doesn't know how much that's such a gift to him, but like to have your first child and then to be able to it's much smoother than what it possibly could have been. Like, that is such a gift.
Oh,
such a gift.
Absolutely.
It's amazing.
He owes me.
I was going to say, but I didn't know if that was right, but yeah.
No, I let him know that all the time.
Are these lactation visits covered by insurance?
Yeah, great question. So we are a member or in network with the Lactation Network, TLN we call that. And that's an amazing program that we can submit the medical insurance information for our families when they come in. So we always ask them, hey, you're coming in for a lip tie, tongue tie evaluation or lactation support, whatever it is. Let's just see if you got coverage through your medical insurance. So we submit, and that day usually we get an answer from that service, TLN, and they say, hey, you got 6 free lactation visits if it's covered. So it's like 6 free visits, free to the parent. So yeah, usually it is if it qualifies. Otherwise, we provide a super bill for those parents that don't have access to the TLN based on their medical insurance, and they can submit that to their medical insurance and get reimbursement that way. But a lot of times it's covered. Absolutely.
Wow. And that 6 visits that gives a family so much hope, especially if they've had a bad experience in the past.
Yep.
What about the tie releases? Are those covered?
Yeah, mostly we have really good luck with private dental insurance. And an example would be like Delta Dental or United Healthcare or Anthem. I mean, there's a whole slew of them, and I'm not even going to begin to talk about the details there. But yeah, a lot of times if it's a covered service with your plan, we always tell parents you have 30 days to get your baby on that after they're born. So we don't want to miss that window. A lot of parents think, I'm not going to put my kid on dental insurance until they're 1 or 2 or 3 and they got teeth. They don't need it. Well, we can exactly, for the few extra bucks a month or whatever it is, it can come in handy. Because you're only going to be waiting a year anyway for your first dental appointment, because that's when we like to see our kids as age 1 for their first appointment. So you're going to use it sooner than you think.
And that's really interesting. Huge. Now, if I'm going to be a parent, I'm just thinking like a real parent out there. If I'm listening to this and I'm like, okay, but if I don't have to add them, I don't really want to. So could they come in, get an assessment if they don't need a release, and depending on when the baby is born, right? Mm-hmm. Because if you do want to aim for that 1 year age to come in and have their first dental assessment, but let's just say it's like December, right? Or November or something like that. And they're like, okay, they don't need a release. Is there any other reason they might need dental insurance other than their first visit that they should be considering it if they don't need a release?
If they don't need a release, generally not. They wouldn't need dental insurance, but you can play that game a little bit. If you got a baby that's young enough, within the first 30 days of life, and we schedule an appointment and we look at the tongue and lip tie stuff, and then we say that there's a problem, we can do everything that day and then retroactively get it covered. So it's kind of a no-lose situation. With the parents, it's $150 for the eval. So that would be the worst if we say, hey, there's no issue. Come on in, pay $150, and then you don't even have to get your kids on dental insurance for the first year, and you save that money by not doing that.
Well, and peace of mind, like you said. Peace of mind. You know it, or you know what it is.
It's a no-lose situation.
Right, exactly.
Absolutely.
Now, you have something else coming up. I believe you called it your minis program. Can you walk us through what is that?
Yeah, first of all, I'm really proud of the name because I came up with that myself. I didn't even chat GPT that. I thought the minis program would be really cool, but it's another thing that we want to do to support families in the area. And we see so many infants, and we know that the problems can get worse with or without a tongue tie if they're not caught early. So that's why we always say first dental appointment around age 1. Well, what the heck are we going to do with a set of parents that's their first kid or their third, and they just want a little bit more support in that first year of life, whether that be lactation support, right? Or it might be speech or feeding support. So what we are developing, and we haven't launched it yet, but we're getting really close, is, do an infant appointment, and then if they want to be part of the program, we're going to get them back at about 3 months, and then 6 months, and 9 months, and a year. And a year is their first official dental appointment. But let's say they get on that dental insurance, we can bill some of those appointments right to dental, and it's going to be covered, usually 2 a year. So that's kind of a no lose for the parents as well. But yeah, I mean, you get that 3-month visit, make sure things healed appropriately. And then if we didn't even do a release, we can just kind of say, hey, how's feeding going with our lactation support team? And then 6 months, we can get the speech therapist on board, and we can see if they're hitting their milestones and kind of talk about baby-led weaning or different feeding options. And 9 months, same thing, just holding their hand through it and using different chewy tubes and stuff like that. And Addie's going to laugh when she hears this, our speech therapist, because I'm learning as well. But chewy tubes is something that she incorporates, I believe, at that age. And then at 12 months, first dental appointment. So just kind of holding their hand through that first year of life. It's something that I wish I would have had as a parent.
Oh my gosh, that's amazing.
Mm-hmm. I mean, and like we talked about, especially with your first child, and every kid is different, but especially with your first child, things are changing every couple months. And so as much as you feel like, oh, you finally get a grasp on what you need to do or whatever, now all of a sudden, oh, actually we can start solid soon. I have questions around that.
Absolutely.
Oh, and then now weaning I have questions around that. And so just to have that resource sounds really, really awesome.
I wish it was standard. I wish that was standard. It should be standard.
It should be
for
standard.
Everyone.
Because, here's the thing. You can find any information on the internet, for let's say baby-led weaning and against baby-led weaning, right? So what the heck do you believe? And then if you ask your parents that parented you, they have a strong opinion, and it's like, who do you believe? And who? So providing that expertise, I guess, would be just
or just to bounce ideas off, right? Maybe it's not for you, but why? You can talk through it. It's great.
Yeah, that sounds like a great program. Well, I'd love to finish this episode out with one more question of what do you feel like your best advice would be to a new mother who is struggling with lactation or breastfeeding?
Yeah, like I said before, get someone on your side, whether that be a really good lactation consultant. IBCLC, a board certified lactation consultant, is preferred, and all of ours are. But otherwise, a good partner at home to support you through that, and just learn as much as you can through other people that have gone through it, and tap into your resources in your community. But definitely seek out a lactation consultant if you can, and you have one available. That'll be my first piece of advice.
And I feel like we have a little bit of a unique perspective here because you're a dad, right? Yeah. And so like Drea and I, we were the feeders and you were the helper essentially. So I guess from one dad to another, if we have some dads listening, what do you feel like dads can do to support their wife at home if she is breastfeeding?
Yeah, get really good at saying, yes, dear. No, I'm just kidding. My wife doesn't even like when I say that. But my nickname when we had a baby was the milkman. Okay, as stupid as that sounds. She pumped the milk, and I took everything from there. I said, you go do something or feed the baby or whatever you got to do after you pump, and I will take care of the milk. I'll store it, I'll label it, I'll freeze it, I'll do all that stuff,
wash the parts,
do all those things. So I did not put that on her, and that's a big burden for moms. So that's just a simple way that dads can step in and help their partner.
That's great advice. Yeah.
Mm-hmm. Having water bottles, snacks available, things like that. I think those are other things that we've heard that a lot of women are like, oh, that was so helpful. As if they're sitting on the couch and they feel a little stuck because they're nursing at the moment or pumping at the moment. They're, attached to an outlet. Yeah. It's like, can I get you some water? Can I get you a snack or something? Because you haven't had a chance to think about yourself.
Whatever they want, just do it.
Yeah. Or can I help anticipate, right? Like you anticipate, oh, the kitchen needs to get cleaned or the laundry needs to get folded. Just go do it, dads. Go do it. Yep.
Absolutely. I can take that advice as well.
Well, thank you so much for joining us in this episode. I think it's just so helpful to be able to hear what the journey can look like, how these things all fit together, these different types of services. And we're not done yet. We're going to be jumping into myofunctional therapy as well as airway health in our next 2 episodes. And these are really key, and everybody should really know about these. So make sure that you stay tuned for those episodes next. If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time, and thank you for being a part of the Motherhood Alliance family.